The federal government reporting that the following for 2023: Medicare spending, now $1.03 trillion, up 8%. Medicaid spending, $871 billion. Your private health insurance costs soaring 11.5% to $1.5 trillion. And your out-of-pockets now at $5.5 billion. Do the math, folks. That's over $3 trillion in healthcare spending in 2023, or about $10,000 for every man, woman, and child in America. And yet, some of our health outcomes are not nearly what they should be. How do we fix that kind of problem? Robert Ford, the CEO of healthcare and pharma giant Abbott Labs, speaking about that very issue today here at the conference. Robert, really appreciate you coming on CNBC. Those are big numbers, $3 trillion.
They are, yeah.
We want everyone to get the best quality care, but how do we be less sick so we have better outcomes, better health care, but spend less? Is that possible?
No, everybody says that, right? Better outcomes, spend less, more access, and nobody's going to go through any pain. We got to change. We got to change how we're doing things. I think we've been talking about preventative care for decades, and I think that really that's the focus where we got to go. We got to move the spend from taking care of the problem to preventing the problem. But I think now consumers are demanding that. Consumers are willing to spend and invest in their healthcare. We saw that coming out of COVID, and they're wanting to do that. And when you think about prevention, it's about behavior change, right? How does one change their behavior? Listen, do I know bagel, cream cheese, and OJ in the morning is not good for me? I know that. But how can I get that information so that I can get confronted with it and make changes in my behavior? And that's what I think the key is how do you transform that information for consumers?
You're a smart guy, so I know you've heard this a million times. There's a group of people watching or listening right now that will say, there's the cynics. They'll say, does the health industry in America really want us to get healthier when there is a big pharma wants to treat illness, not fix it?
Yeah, listen, I get the cynics. I get that. You could probably say that across a variety of different industries. We're in the business of helping people get healthy and stay healthy. One of the things that Abbott has been doing actually is we're gonna address problems, medical problems that exist, but we're also looking at a place in the industry that we usually don't spend a lot of time in, which is healthy people that want to stay healthy. So we've been making investments in that area. So, in the cynics, you gotta back it up, right? So we've developed technologies that are helping to do that. One product that we've launched recently is called Lingo, and it's directed towards people that want to understand what happened, when they eat, their mood, and how that influences their health. So
and that came from a failure, actually. It was like a technology problem that turned into one of your biggest products.
Yeah, that's Libre, which is a continuous glucose monitor for people with diabetes. And when we launched that, what we started to see is people that didn't have diabetes were using the product to get better insight on their health. Again, on the theme of being preventative. So we then developed a whole new system just for that population.
Well, you said something really interesting when we were talking before the interview. A lot of people I see once a year here at this conference, and a lot of people they've lost a lot of weight, and a lot of people just be honest that they're on the shot. Zepbound, GLP-1s,
yeah,
Ozempic, whatever it is. You made a critical point. You said that's great, but watch out for muscle loss, because that's a lot of the weight, and you guys have a drink to help counter that.
Yeah, so one of the challenges when you have that kind of weight loss is that you're also going to lose muscle, and muscle is important. Muscle health is important. So we saw that as a need. So we're a leader in nutrition. So we developed a nutritional drink that's heavy in protein, heavy in fiber, and heavy in HMB to help preserve muscle mass.
Yeah, and that's critical. So a lot of people are losing weight on these drugs. They're not yours, but your message to them is just be careful about what kind of weight you're losing. It's not all created equally.
Yeah, these are great drugs. I mean, it's incredible what they're doing, but at the same time, you have to treat your health more holistically and look at all aspects of it, right?